Okay, can you tell me what's your name, where you're from, and what brought you to the clinic?
My name is Livia Birau. I'm from Romania, and I come in Belgrade to the clinic because I have a 6 years old son, Alexandru, which is autistic nonverbal.
And when, how old is he, and when he was diagnosed?
My son and my history about autism is starting when Alex was 2 years and a half. I observe difficulty to socialize and a very repetitive action. And this was the moment when I asked help, because at this time I live in London, to the healthcare, to the GP doctor, to everyone, and I specify something is going wrong in my son. And everyone give me the advice to waiting, because with by year and year the kids could be any kind of problem, but I haven't the feeling like mother is something what is not going well. And from here I start to go to the nursery, and here again the people said definitely something a problem with him. And when I observe in London, because it's the rules to wait a bit until the child is almost 4 or 5 years, I leave London and I run in Malta with him and with my job. Maybe I should say I'm a nurse specialist, which was very easy for me to doing the document and to find a job in Malta. In Malta, I have a beautiful experience. In 6 months, I have the diagnosis, and the diagnosis for Alex like autism moderate. I start all the therapy with the neuropediatry, logopedy and everything. After that was a beautiful country, Malta, but because it's small, the number of logopedists is very low and again difficult. I believe I ran all the Europe for him, and in the last 2 years living in Spain. When I go in Spain, I have the confirmation about my son problem, autism nonverbal. And I have started to read about STELSEM, the benefit. And I inform myself in 3 or 4 countries like Austria, Istanbul, and I found Polonia, and I found you, Belgrade. What I have taken so many information, because all the other countries doing auto transplant, which could be much stressful for the kids under general anesthesia. But in Belgrade I found something specific and much easy. I have done the transplant and my son have through IV, through cannula. In 1 hour the infusion. It was 2 bags of infusion, and was not necessary any kind of sedation. And this was very important for me to don't give any episode of trauma to my son. And I'm happy for my choice, because it's important to do the therapy for the kids, but it's important to don't damaging more with this therapy. And before to choose to do the auto transplant, Alex enjoying in Egypt delphinotherapy, which is different, but on the same time, you know, for kids could be this beautiful friendship with the animal. Very nice, and this was very nice, the delphinotherapy and all the other therapy what the doctor giving to the kids with autism. But the most important thing what the parents should learn, maybe with help, because it's difficult, first of all, to learn to live with autism and with your children. Because if you refuse to accept it is a problem, will be very difficult to help your child. I observe around me the kids could have more help, but because the parents is difficult to accept, will live longer and longer the time for the treatment, and will take the action very late, which is not good. Our kids somebody said it's much nice and maybe posh to say special kids. But I think our kids with autism is not the special, it's everything for me, like mom. Because I learned to live my life with my son, and in between of me and my son is the autism. But it's everything so natural, don't bother me anymore. Me, I look on the eyes of any parents which have the kids without any problem. And I consider my son have the same possibility of the education, have the same possibility of medical condition. And I feel normal. It is my normality, but it's normal. And my son doing everything what the other kids doing, from sport, from education, from smiling, from running, from it's I don't want to say it's our word, because I don't want Alex to feeling it's close. Alex is very open, who going to play with the kids everywhere and when he want. And because, how can I say, the specialist what working with Alex said to treat Alex like any other kids, and this is what I do. I know to say Alex no when it's necessary, like I know to say Alex, now mama, you should fight and you should do what is necessary. And what I can say, just keep an eye on you like parents, because a good health of the parents is very important for child. If the parents becoming depressive by the situation with the child, if the parents consider it's too much, or is totally unhappy and very frustrated because the child have a problem, the difficulty of the situation is bigger and bigger. And why not, if you can, if it's happened any day to feel or to crying and to say I'm fed up, I can't anymore, take and ask for help. Ask for help to the family, to a grandnanny to come half an hour. Ask help to the specialist. Look, doctor, I have my son, I have this problem, I can accept, and I become more nervous, more upset with my life. Take the action if you feel is becoming in depression in your situation, because your son will feel and will gain everything you need just if you, like parents, you are happy. Because I like to say the kids is a reflection of the parents. A happy parent is a happy kids. A frustrated parents and a parents who don't want to accept the situation will do the difficulty of the child to develop.
I want to get back to the point you mentioned about that your child was diagnosed with mild autism, right?
Yes, please.
Can you please describe a little bit more in details how the symptoms were manifested during the day, and what challenges have you faced as a parent?
What has happened? My son Alex, it was very close, not socialized with other children. He's not playing just with a small toy. Like popular, the people said, it was in his word. Have difficulty to sleep at this time, very and huge difficulty to sleep. And was happy like child, but don't have a childhood. It was properly close in his word, you know, with the attention, with the eye contact and everything, was all the element for autistic child.
When you mentioned that you found about stem cells, find out that there is a stem cells, what have you read or what have you seen about stem cells that you decided to try?
It is a bit biochemistry if you think about stem cell. After, if you want to think about natural things about maternity, the people should know the stem cell is coming from placenta or cordon, the umbilical cordon. which much natural than that, I don't think so in the world is possible to have much natural and with a good effect. And by profession, I start to study the potential and what good could be. And in my mind is coming like who using the stem cell is like a regeneration of the body with this stem cell, and will not be just the brain cell what my son could be affected, could be. It's a regeneration on all body, and this is the reason why I consider to do this type of transplant.
And have you got any moment when you was scared to try stem cells, because in the internet there are different information about stem cells?
Yes, like I said to you, when I inform myself in different countries like Australia, and these people working with auto transplant, which means to take by the same child under the general anesthesia from the spinal area, the cell stem. Here was the moment when I said no, I will not put my son in dangerous situation. The dangerous situation is the general anesthesia, and who is from the medical side will know that. And the second high risk it is to take from the spinal area, the cell stem. And I can accept. Nerida, I can accept when I speak with the clinic in Istanbul, who explained to me the benefit is better if you take from donor the stem cell, but you will do the infusion again on under the arm and on the spinal area. And I said pass. Let's go to trying things more natural, and like I said, to don't give more stress and to the family and to the kids. This is the reason why I chose Belgrade with the transplant, because I have the feeling it's much easy the type to doing the process.
Are there anything came to my mind? Let's say, have you seen or heard about Swiss Medica that you decided to go to Swiss Medica?
No, you know what? I have the information about you by a friend in London. She was coming here with her son 1 year ago, 3 years and a half. And this is how I found you. She have done through your clinic the transplant. She gave me the information. I contact Ms. Ruzica, who is your manager with the client. And why Belgrade? I'm pretty honest, because the possibility to do a transfer of the cell stem, it's a bit very in Europe you can find. It was another friend who go to Panama. But I said, why all this way when it's here in Europe, the same quality? But I don't know if you need to have I think the parents should inform very well what to do. And like I said, don't expose your child in a traumatic situation. Take slowly and use the easy way, because not everyone know a child with autism, all the feeling is more than 1,000 how can I say it? When somebody shouting, or the trauma for the kids with autism, you should the measure side it's 1,000 high than in a normal child. And do you imagine, you think you will go to do a treatment, and at the end maybe your child will come out with more fear, and it's not good.
What type of stem cells have you received at Swiss Medica?
I have done the stem cell from placenta and microcell, which is the same, very important, but from placenta.
How about umbilical cord blood? No? Only placenta?
Not yet, because it's the
not
first time when I came.
Okay.
And I have done placenta now, and next time we'll take step by step.
Exosomes?
Yes, please. I have done exosome. I have done the type of exosome intravenous, and I have after a dose of nasal spray to using for a few weeks, and after I have inhaler with the exosome. I have all.
And do you understand you correctly that you didn't you didn't make any kind of sedation here.
Yes, it's true, and I explain you why. Maybe because I use a trick. And the trick it is, when you need to do something with your kids with autism, it's good the environment to don't go too many nurses, because this will scaring. And what I have done on the first day of the treatment, it was take the blood, very gentle, without any kind of problem. And on the treatment day, I come with my son, honestly. I have explained to the doctor I can cope 99%. I have left my son nil by mouth in case, will be any kind of problem. And I take him, I said to my mom, she's with us here, to leave Alex free, not to stay to hold his hand or something, because him have a pretty strong personality and character, but him like child don't have any episode of violence or something, is a very good one. And I have started infusion with a lot of emotion, but slowly talking with him, put the music, all the team was around us, but not all together, just one by one, looking, laughing. And yes, it was possible to doing the sedation, because was not necessary, and honestly, I'm not keen to sedate too much, Alex, It's better to play, to sing and song and dancing. I think I dancing a lot on the salon on this day.
Nice. What else I want to ask? Have you consulted with your GP before trying stem cells?
Yes, the GP from Spain, it's much open mind. Don't, how can I say it? Like doctor, you can give a direct answer, or you can give an answer which the people can read under the word. And from Spain, the GP was happy. Instead, will not be any negative situation after, like any doctor, yes, please do, but to don't have any interaction, any problem. Definitely in England, the people, it's not keen to using. The people is not keen in England either to use the delphinotherapy, do you imagine, the cell stem. But what I observe, the doctor, the GP in UK is not happy, but you have 99% here. The people who coming with kids from London, maybe you don't know, but me, I know. And why I know? Because I observe on the day when I have been in clinic. Which means the people who have the eyes to see and the ear to hear will read and will take the good action.
So, as I understand, doctor in the United Kingdom, you didn't have consultation. You didn't have a consultation with them. Or
No. I have done the question. Look, doctor, I'm interested to doing to my son this, and he was not very keen. No, I don't believe. I don't think so.
Got it. Now I understand. Yes. Okay. What is your expectation about?
Honestly, first of all, I take like experience, properly like experience. And I'm happy because this experience was a beautiful one. The expectation, the real expectation, we'll see. I learn to be happy for every small gain of my son. And because this experience, I think, was more for me than my son. I know it's interesting to say something like that. But when I come here and I see a lot of kids with a huge problem than my son. Yes.
You mean much severe problems?
Much. More. Probably was like a cold shower for me. And me, who I consider I have seen a lot of things in my life, is not true. The expectation regarding Alex, more than normal, to gain something. Him is in a very good point, Alex. You should know. Him don't have any difficulty just to talk. This is the problem what Alex have. to gain something. But I'm not, how can I say it? Definitely I'm not come here to thinking, oh, I come back with Alex and him will talk. I take this treatment just something positive, what definitely will help his body. It's not like I don't have any expectation. I will be happy with the gain what will come, wherever will be.
What would you recommend to someone who is considering stem cell treatment for his kids with the same condition? What's your advice?
First of all, to inform by any media, and usually it's better to ring the clinic and to have all the advice from the clinic more than Google and any other search. To inform himself about the process and everything, first of all. And second of all, to listen to specialists who dealing with the stem cell. I will explain you why. If your son will have a level of autism low or high, will be just the doctor who will know to give you the correct treatment. Because you, like parents, you will see on the Google 3 types of treatment, this and this, but the answer and the correct way will give you just the doctor specialist who will be on this clinic or in any clinic on the world.
And did you have a chance to talk to our doctors before coming to the clinic?
Yes, always. It's you are very good in this. I have a discussion about everything with the lady, with Miss Ruzika, who dealing with all the information. And after that, before to came, I have a discussion and the interview with the doctor who Alex have the transplant with her. And again, I have all the information. And at the end of the treatment, again, the same doctor have give all the certificate and everything and all the information. And what is important for me, and I don't think so just for me, it was very nice to observe your clinic give the certificate of quality for the stem cell. And you should be very careful, because this is very important to know what kind of treatment you will give to your child. More if you are not on the medical world, it's coming the parents who will do any other job, will see the child, with the IV, with the infusion. And maybe, I don't know how it's in the different place. You'll think about, oh, but still my son, what him have? No, here you'll have a certificate.
You mean
with the registration number and everything for all the treatment. What is important.
Yeah, you mean what's inside of the infusion you don't know, so that you are getting the certificate.
All the information. And if you don't know about medical things, you will have all the paper with the number, with the quantity, with the quality, how was done, how it was dissolved. This is very important.
Mm-hmm. Would you like to say something else?
But I think you know about the team of the nurse who is lovely, about the doctor the same who is very patient, about I have been done the friendship, you should know, with a lot of parents from different country. But this is not us like parents. I think it is a new like clinic who have on the side where the people can eat, on the restaurant side, a place where you can stay with the children, when the parents can change the information in between, what treatment you have done, how is your son, when you come back. A very familiar environment. You don't feel like you go in a clinic, you are a number or a patient and this is it, because it's very rare, to feel that. And yes, you have a high standard, and for the hotelier things, which is the restaurant, the food, where the people will sleep, you are very good in this. And I will advise, maybe the clinic will come with the idea for the people who have the stem cell, maybe anytime, 1 time a year, to do a kind, not properly a reunion, but something like when all these people who have the cell for 2 days to come with kids, to see each other, the medical team to give to us the advice, to explain maybe something new, maybe to see again the kids, to observe everyone, to change the opinion about how is now, what the kids was gain. I think because, I will explain you why. For the parents with the special kids, when you go in holiday, you have 1000 anxious things. Oh my goodness, how will be? Will be good? Will listen to me? But I have a few days when I'm here. I stay with other family, with the kids with the same problem, like my son. And I don't feel anymore, oh my goodness, don't disturb. Oh, what him doing? No, I feel like, it's fine. What will do my son will do and the other kids. And it's very important for us, to feel well. Because for us it's very difficult when you go in some place to feel well and to don't have all this, in your heart.